Hi, happy Thursday. Welcome to Soulibration. I'm your host, Shameika Rhymes. Let me know where you're watching from and how your week's been going. Drop that in the chat. I always love to see where you guys are watching from. And remember to share this with your network. And of course, if you have any questions throughout the show, drop it in the chat and we'll make sure we'll try to get to them all. But you know how this goes. It just depends on how good the conversation is flowing. But if not, we'll try to get to them after. So today we are talking about medication assisted treatment. It's also known as MAT. So if you guys hear me refer to it as MAT, that's what I'm talking about. And despite its proven effectiveness, MAT remains shrouded in a bit of stigma and misconceptions. So Dr. Nzinga Harrison, co-founder and chief medical officer of Eleanor Health, is joining me today to talk about some of those myths and shed light on how MAT can effectively and significantly aid recovery when used as a part of a comprehensive treatment plan, especially when it comes to opioid and alcohol addiction. So let me tell you a little bit about our guest tonight. Dr. Harrison, like I said, she is the chief medical officer and co-founder of Eleanor Health, and she is a double board certified with specialties in general adult psychiatry and addiction medicine. Welcome, Dr. Harrison.
Thank you, Shameika. Good to be here with you.
I'm so excited. I see we've got someone watching from Connecticut, Carrie Graham. Oh, Dr. Carrie Graham. We've got some people coming in the building. Y'all come on in, have a seat.
Hey, Dr. Graham.
So we're going to start this off with, because I think sometimes, people will just say, oh, yeah, I'm addicted to social media. I'm addicted to this. What exactly is an addiction, or how can you define an addiction, whether it is to opioids, alcohol, or even food?
Yeah, I love this question because we do throw around the word addiction kind of lightly. And so if you think of the big concept of addiction, it's continuing to do something despite negative consequences outweighing positive consequences.
Mhm.
And so I think it's super important to understand as humans, we don't do anything that doesn't have positive benefits, right? Like
Mhm.
positive benefits is the reason we do things. And so drug use is a choice that the majority of Americans make, from caffeine to marijuana to vaping to cigarettes, to methamphetamine, to cocaine, to heroin, to pain pills. Drug use is a choice that the majority of us make. Addiction is when it crosses over to use no longer being a choice. So it's like a compulsive use of that substance,
Mhm.
despite negative consequences, have begun to outweigh the positive benefits. And I love that you mentioned food. Food addiction is real, sex addiction is real,
Mhm.
gambling addiction is real, social media addiction is real, video game addiction is real, work addiction is real, exercise addiction is
Mhm.
real. We can do all of these things compulsively
Right.
to the point that negative consequences begin to outweigh the benefits.
Well, at what point should one seek help? Because a lot of times people don't think they need help because they're trying to mask that fact that they have a problem, or they may
Mhm,
not think it's a problem until someone points it out over and over and over again. And at that point, they still may not think they have a problem.
mhm. Yeah, you're pointing out two really important dynamics that happen. One is, and this is true about everything, not just addictions,
Mhm.
other people can see when we need help before we can see when we need help,
Mhm.
right?
Yeah. Yeah.
Other people can start to see the negative consequences before we can start to see the negative consequences, because we're still experiencing benefits, and our loved ones and the people around us can
Mhm.
see the consequences without the benefits. The second is shame. So we
Mhm.
put so much stigma around this chronic condition, around this illness. And that stigma really is deadly. It makes
Mhm.
it very difficult for you to even ask yourself, am I struggling? It
Mhm.
makes it very difficult for you to talk to someone you trust and say, I think I might be struggling. It makes it very difficult to ask for help. You like worry, what does this mean for my job? What are people going to think about me? Am I
Mhm.
going to get kicked out of the social circles that I'm in? And so To answer your question, when should you seek help? When should a
Mhm.
person think about getting help? I want you to think about this the same way you think about breast cancer. We do
Mm.
not want to wait until
Right.
cancer has spread through your
Mhm.
whole body. We want you doing a monthly breast exam so the very second a lump comes up, even if you don't know it's cancer, you can go to a
Mhm.
professional and get an idea, right? And so what I like to give people is a tool called the CAGE, CAGE.
Okay.
This is an acronym.
I
Okay.
love acronyms.
All right. C. Have you ever felt you should cut back?
Mm.
Every
Okay.
time you answer yes, give yourself a point. A. Have you ever been annoyed when someone else asked you about how you're using that substance or that behavior? Because remember, we said other people can see it before we can see it.
Right. Right.
G. Have you ever felt guilty? Like, dang, I said I wasn't going to do that. And then
Mhm.
I did that,
Right.
right? E is for eye opener. First thing in the morning, is it on your mind? Do you have to take a drink to get your day started? Do you have to do the moment you roll over? This is me talking to myself. The alarm is not even all the way off. I'm already on my email, right?
Oh, yeah. Yeah.
Um, and so if you answer yes to one of those questions, it does not mean that you have a substance use disorder,
Mhm.
but 77% of the time, it means you meet diagnostic criteria for a substance use disorder. And so
Wow.
whether that's mild, moderate, or severe, right?
Mhm.
So at 77% of the time, if you answered yes to just even one question, that's a lump that's
Mhm.
worth looking at.
Mhm.
And if it's 20, you're in the 23% that you don't yet meet criteria
Mhm.
for a substance use disorder, I'll use that interchangeably with addiction, then this is your opportunity to prevent yourself from progressing to diagnostic criteria. So CAGE.
Okay. That's a great one. Cage. Did y'all get that? Cage. Drop in the chat if you guys have ever, if you checked off. I mean, you don't have to, but just if you don't, you don't have to tell us which one. But if you checked off one of those, because again, we all probably have experienced some kind of addictive behavior, whatever it is, social media, food. Because it's like I'm not going to get the other piece of cake. I'm not. And then
Right.
you, the whole next thing, the whole cake gone.
That's exactly right. That's exactly right.
Yeah. So once that person has gone through that, the CAGE, and they say, okay, well, wow, I checked maybe two of those off.
Mhm.
Call the doctor. Go to, well, first, what doctor should they see? And then second, can you walk us through what that visit would look like?
Yeah, so I think this is really important. People automatically think go to the doctor, and that's a legitimate thought. But
Hmm.
there are so many places that you can go, right? Like, I want to be very sensitive that the stigma around this condition is very high. And so it can feel very unsafe to go to your doctor you've been seeing your whole life, and what are they going to think of me? They're just going to be ready to help you. But you can go to a faith leader, you can go to your
Mm.
pastor,
Yeah.
you can go to a friend that you trust, you can go to a family member that you trust, you can go online and find a support group,
Hmm.
you can go to a community meeting, right? Like, there are so many different ways to get help these days. What I tell people is, I would love for you to find a doctor, and
Hmm.
the first doctor you should find is your primary care doctor, right?
Okay.
If you
Yeah.
already have a therapist, your therapist. If you already have a psychiatrist, your psychiatrist. Any of those folks will be able to get you to an addiction specialist like us over
Hmm.
at Eleanor Health if you need that. But like every illness, addiction comes in mild, moderate,
Hmm.
and severe. So everybody that has an addiction, just like everybody that has high blood pressure doesn't need to take medication,
Hmm.
some people can exercise and change diet and decrease stress. We have that same spectrum. So reach out to somebody that you trust and feel safe with. But
Mhm.
from a doctor perspective, your primary care doctor, your therapist, your psychiatrist, all will be able to help.
Okay. Those are great ones to remember because sometimes you think, oh, like, oh, I cut my finger, let me go to the doctor. But you don't think about there are other avenues where you could
That's
go to
right.
the clinic at the pharmacy, or just there's other places you can go for different things. So can you explain at what point you would do the medication assisted treatment, and a little, and maybe we should start with what it is.
Yeah.
Yeah, let's start there. What is it?
Yeah. So I'm actually going to change the words that we're using for this acronym.
Okay.
Um, when it MAT, when it was first defined, this is like, call it 20 years ago. Don't quote me, y'all. Don't quote me on the time frame, okay? A long time, right? It was called medication assisted treatment.
Mhm.
And that really came out of the 12-step AA concept that treatment is not using any substance at all, including a medication, and that recovery is only complete abstinence from everything. And so
Mhm.
it actually carries this stigma with it that we have to overcome a lot at Eleanor Health when we're educating and supporting people, that like somehow you're still addicted if you're taking this medication to
Mhm.
manage addiction. And so medication assisted treatment makes it seem like medication is not treatment, right?
Right, right.
And so ASAM, which is the American Society of Addiction Medicine, I actually co-chaired their practice management committee a couple of years ago, and I love them for this because language is so important. Said
Mhm.
everybody knows it as MAT, but we don't want to keep sending this stigma accidentally in our language. So we changed it to medications for addiction treatment.
Oh, okay,
That's nice,
okay.
isn't
Yeah,
it?
I like that, I like that.
Yeah. So, okay, with that setup, what is MAT? You can think of MAT exactly the same way you think of medications for whatever else.
Mhm,
So, MAT is medications for addiction treatment, just like blood pressure medication is medication for blood pressure, just like insulin is medication for diabetes, just like your inhaler is medication for asthma.
mhm.
It's exactly the same thing. We have medications for addiction treatment, MAT, for alcohol use disorders, FDA approved,
Okay,
for opioid use disorders, FDA approved, and for nicotine use disorders, FDA approved. We also have medications that the FDA has not yet approved specifically for, but that
mhm.
our medical evidence tells us are effective for marijuana use disorder. Yes, people get addicted to marijuana, not
Oh,
everybody. Also, everybody doesn't get addicted to cocaine, more people do. But
mhm.
yes, people get addicted to marijuana. And then also for methamphetamine and other
Okay,
stimulants related to that. So we have MAT for all of those. The most commonly used MAT is for opioids and alcohol, which is what we're going to talk about today.
okay. And I wanna remind everybody, if you have questions, be sure to drop that in the chat, and we'll get to those. But it's interesting that the wide range of things that you did mention, and like you said, we are focusing on the opioids and the alcohol. But how does it work in treating those?
Yes. So I want to first start with the understanding that, like other chronic conditions,
Hmm.
addiction and substance use disorders have three types of risk factors, three types of reasons why you develop these illnesses. There's biological. So, like, most people don't know that 40 to 60% of your risk of developing an addiction is coded in your
Hmm.
DNA the day you're born. It's passed down in families, right? That's higher than high blood pressure. That's higher than diabetes. That's higher than asthma. So, more of your risk for developing a substance use disorder is coded in your DNA the day you're born.
Wow.
Also, biologically, like things happen to you over life, right? Like
Hmm.
you develop illnesses, you get injuries, you get a prescription for an opioid pain medicine, you
Right.
develop anxiety, you get stressed out, you can't sleep at night, you start drinking to help your stress. So
Hmm.
like you also acquire things later in your life.
Hmm.
When we talk about interventions, then biologically, what we do is medication.
Right.
But there are also psychological and environmental reasons, with the environment being cultural and your physical environment that you live in.
Mm-hmm.
All of these have to do with the illnesses that we develop. So the first question you asked me was, when do I think about using medication?
Mm-hmm.
For addictions that are mild, I'm probably going to try psychological and environmental interventions. That
Okay.
would be therapy. That would might be mindfulness and meditation. That might be reducing stress. That might be increasing your support system. That might be finding meaning and purpose in your life, right?
Mm-hmm.
When I get to a moderate substance use disorder, and so you can think of that like when your doctor tells you you have prediabetes.
Okay.
You have prediabetes, I'm not prescribing you insulin. We're like
Mm-hmm.
trying to do all this over here, right?
Right.
Exact same concept. But when you tip over that blood sugar into diabetes, now I know the risk that that diabetes is causing for you. Now I'm like, we want to do all this psychological and
Mm-hmm.
environmental intervention, and I want to add a medication to give you the best chance that this illness doesn't kill you, because addiction is deadly, right?
Right.
And so
Yeah.
if a person comes to me and they have, I go through my diagnostic criteria and they have a moderate substance use disorder or a severe substance use disorder, I'm automatically thinking about, how do I reach in all three of those buckets? What can I do with the medication
Mm-hmm.
biologically? What can I do with therapy psychologically? What can I do with your environment culturally and socially, and from stressors and support system? So we think about it the exact same way we think about all medical conditions.
Okay. Do you think that there's, because I think you explained it very well, and now I think I understand, but what is the stigma around it? Is it just because, if it's opioids, if they're taking pills or something and now you're giving them medicine, is that kind of where that stigma
That's
lies? Okay.
exactly where the stigma, and so the stigma starts with the addiction itself and really starts with mental health conditions. Addictions are mental health conditions, right? Because
Mm-hmm.
the symptoms are thoughts and feelings and behaviors, and people actually don't appreciate how much mental health symptoms are also physical. But we
Mm-hmm.
see the thoughts, we see the feelings, the behaviors. We get confused like, oh, we think that's who you are. We
Mm-hmm.
think that's your personality because it's the way you interact with me, right? When it's
Right.
actually a set of symptoms. And so
Mm-hmm.
all of the stigma is like, make better choices. Don't be rude. Don't use drugs if you know it's causing you
Right.
problems, right? Because those symptoms can be hard to recognize that they are symptoms, not
Mm-hmm.
they are the person. And so when that stigma comes, exactly like you said with the drug, it's like, why am I going to give you a drug when you just need to not use any drugs?
Right. Yeah.
But if we can appreciate, just like with diabetes, your blood sugar is high. With
Mm-hmm.
hypertension, your blood pressure is high. With asthma, your breath is short. Those are symptoms. We use
Mm-hmm.
medications to manage those symptoms along with psychological and environmental interventions. Exactly the same here. Your symptoms are using more than you intended, not showing up as a parent,
Mm-hmm.
not doing well at work, having withdrawal symptoms, passing out, blacking out, driving under the influence. These are the diagnostic symptoms of a substance use disorder. And so
Mm-hmm.
we use a medication to treat
Okay. And what if someone that has an addiction, but they come to you and they're not fully being honest about the things they're experiencing? So then how do you know what category to put them in, if they're
it. Yeah.
moderate or severe or any of those things? Because they may just say, you know what, I blacked out once,
Uh-huh.
and then leave it at that. They may not tell you the full truth. So
Yep.
then what do you do?
Yeah, and I put that on us. So there's so much stigma and shame,
Mhm.
unfortunately, associated with addiction and substance use disorders. That's on me, and this is something we really focus on at Eleanor Health, is like creating the safety for you to know, I'm not going to judge you.
Mm,
So
mhm.
come in here, tell me what's going on so we can make the best safe decisions together based on what's going on with you. But there's a statistic, 80% of people lie to their doctors. That's not
Hmm.
an addiction statistic. That's a general
Yeah.
primary care,
Hmm.
right? So like you said, how many days a week do you eat cake? You're like, oh, I like one or two. You'll be
Right.
eating that cake every day, right?
Right.
And it's because we're afraid to be
Mhm.
judged. And so
Yeah.
that's on us to make it safe for you not to be judged. To answer your question, if a person can't tell me everything that's going on because our relationship doesn't have that level of safety yet, there
Hmm.
are objective things I can look at. So I can draw your blood, I can look at your liver, I can look at your
Okay.
electrolytes. That's going to tell me a lot. I can do a drug screen, I
Hmm.
can do an alcohol level, I can talk to your support system. Like I said, other people can see
Yeah.
it before we can see it, right?
Hmm.
Um, I can look at the medications you've been filling. I can hear the other symptoms that you're telling me. And so this is
Hmm.
why it's important to go to a professional that knows how to diagnose substance use disorders, because you don't have to tell me everything. I can
Hmm.
usually in the evaluation get to it.
Okay. Let's see here. Again, y'all don't forget, drop your questions in the chat and we'll get to those. But so, and I don't know if we can actually go into what these
Yes.
medications are, but I'm
Okay.
dying to know what are these medication options that are available and how do
Yes.
they differ in approach to the treatments that they're for?
Okay, I love this question. So let's start with alcohol use disorder because the
Okay.
medications are different for the different types of drugs, even though we have some that are the same. So for alcohol use disorder, um, I'm going to give you this concept. This is for drugs, period. It's a lock and key. This is how like everything works in your body. You have a chemical, and
Hmm.
then you have a nerve cell in your body, and it has a receptor. And the receptor is shaped a certain way, and the chemical is shaped a certain way, just like your front door key fits in your front door lock, but
Hmm.
your front door key doesn't fit in your best friend's front door lock, right?
Right.
So
Right.
you have opioid receptors, and opioid binds opioid receptors. And then it sends the whole opioid message, which is like, don't have pain, physical pain, don't
Hmm.
have emotional pain, be sleepy, very dangerously, don't breathe. That's how
Hmm.
people die of opioid overdose, because one of the opioid messages is literally don't breathe,
Oh,
right?
wow.
You have GABA receptors, and alcohol increases a chemical in your brain called GABA, and GABA binds that alcohol
Mhm.
receptor. And that
Okay.
gives you the alcohol signal. Relax, be fun, have less inhibition, right? Like
Mhm.
loosen up. That's
Mhm.
alcohol's. Don't be anxious. That's alcohol's message. Methamphetamine, there's a stimulant receptor, methamphetamine binds it. The message
Mhm.
is focus, concentrate, right? So when we look at how our medications work, our medications can bind that same receptor and block it. So
Okay.
we have opioid blockers. So when
Mhm.
you take an opioid blocker, if you use heroin or a pain pill, it can't get to the receptor because the receptor is blocked, right?
Mhm.
We have medications that bind that opioid receptor and give a weak signal. And so when heroin comes along, it can't get on the receptor because this medication is already on there, but
Mhm.
that medication will prevent you from having withdrawal symptoms. So
Oh,
when you
that was the next question about the withdrawal.
yep,
Okay.
when you stop the drug and you get sick, these medications that give a weak signal will stop you from getting sick, right?
Mhm.
And then we have medications that bind the receptor and they give the full message.
Mhm.
So if I'm starting, I said start with alcohol, but I'll start with opioid. The medication that totally blocks the receptor is called naltrexone. You can
Okay.
take it by pill. You can take it as a shot once a month. The shot is called Vivitrol. Vivitrol, whether you take the shot, naltrexone, whether you take the pill, it gets on that receptor, it blocks it.
Mhm.
When you take a pain pill or heroin or fentanyl, it cannot get on that receptor because that receptor is already blocked. Those are great medications. They are not as effective as buprenorphine, also
Mhm.
known as Suboxone. Suboxone binds the receptor and gives you a weak signal. So it keeps withdrawal symptoms away, it keeps
Mhm.
cravings away. But also, if you take some heroin, some other pain pills, some fentanyl, they can't get on because the buprenorphine or the Suboxone is there. Suboxone is
Um,
actually a combination of buprenorphine and naloxone. And then
mhm.
we have methadone. Methadone binds and it gives the full signal. And so methadone is more dangerous from the perspective that it can suppress your breathing. And so we are just a lot more careful about methadone because it's giving that full message. So that's how they work. And then for alcohol, we also use Vivitrol, which
Mhm.
is naltrexone, and we have other medications. Camprol is another one.
Mhm.
So those are the main medications and how they work. Importantly, it is more likely that you will be alive a month from now if
Yeah.
I prescribe you this medication. It is more likely you will be alive a year from now. It is more
Mhm.
likely you will not be using or your use will be controlled. And so these medications really save lives.
Do you think that cultural and demographic factors will influence a person's willingness to consider this path as a part of their recovery plan? Because, some people may think, I can just go to church and that's it. I don't need this. So do you think that that may play a factor in that? Mhm.
100%. And so, yes, please go to church
Yes.
and take your Suboxone. Okay.
You can do
You
both.
can do what that little girl say in the meme. Why not both? Right?
Right.
Like, yes, please do both. And I'm actually really appreciative, especially of the Black faith community, which is making a huge effort because the other thing is like drug use has been characterized as a sin. And
Hmm.
so it's hard to even go to church and say, I need help because you don't want
Yeah.
people to look at you like you're betraying God, you're
Hmm.
betraying your religion, you're morally bankrupt, you don't deserve to be cared for, right? Like our faith leaders are really doing a great job of trying to comb that messaging out and saying, like, we are here and we
Yeah.
want you to come. And just like we want you to take your blood pressure medication, we want you to take your addiction medication. Just like we want you to go get chemo for cancer,
Hmm.
we want you to go get chemo for your addiction, right? And so
Right.
it really is back to that biological, psychological, social, spiritual, environmental.
Hmm.
The best chance you have for any chronic illness, addictions included, is to be working in all three of those buckets all at the same time.
Hmm. What if, because I know some people will think, like, especially in our community, some may think meditation is the devil's the devil's work, so they don't want to even talk about that, right? So what would you say to a patient that is very resistant to it, if they are on that low level that you mentioned and they say meditation, I'm not doing that. Like, what do you say to them then?
Yeah, meditation or medication or yes, both.
Both.
Uh-huh.
Meditation and
Exactly.
medication, but I was referring
Exactly.
mostly to
Exactly.
meditation.
Yeah, yeah, yeah. So, meditation specifically, we actually have brain imaging
Hmm.
proof. We put people that meditate in the MRI scanner, the functional MRI scanner, and we
Yeah.
show when people are meditating, their cravings decrease, their blood pressure comes
Hmm.
down, their heart rate slows down, their stress hormones come down, right? So meditation is not this like woo woo, we don't know what it's doing. It
Right.
is a biological, physiological, physical phenomenon that is proven to improve health and well-being, physical and mental and social and spiritual, right?
Mhm.
And so meditation is actually on that same spectrum as
Mhm.
prayer. And so,
Yes.
like, yes, all of it, all of it,
Mhm.
all of it, all of it. And so that's the way I talk about it with people. But when
Yeah.
people come in, I say, listen, tell me what recommendation you do not want me to make today, because I
Mhm.
want to hear that. I want to be aware of it. Like at Eleanor Health, we are on your team, right? We are on your
Yeah.
team. You're an expert in you. We're an expert in addiction. We bring those two expertises together, and that's where the magic can happen. And so, if you're afraid of a medication, let me give you some education, but ultimately, that's your decision. If you're not going to take medication, we got to go hard in the paint
Yeah.
on psychological and environmental. If you're not going to do mindfulness, which
Hmm.
is also part of our care at Eleanor Health, we got to go hard in the paint on medication and therapy, right? And so
Yeah.
we can get that mix according to what feels good to people, but we just try to do a lot of education and
Hmm.
reducing that stigma.
Can you just for a second talk about what mindfulness is? Because I don't know that that that's something everybody knows what it is. I know I've done it before and I do it every day. So, but from a doctor's perspective, because I'm sure you have a better explanation than I do.
Mhm. So, kind of like broad concept, mindfulness is being intentionally in this moment.
Hmm.
And so we spend so much of our time, we think we're multitasking, but did you know that your brain actually cannot multitask?
Right.
Your brain can only do one task at once. And so it's just constantly switching. And
Hmm.
that constant switching, one, is exhausting,
Yes.
two, is stressful, three, makes you less effective, right?
Hmm.
But if you think about our day, like I'm in the shower, being mindfully in the shower is tuning in to the feel of the water hitting my skin. Now,
Hmm.
the regular way in Zynga is in the shower. It's like, okay, what's my to-do list for today? And I'm thinking through my to-do list and the
Yeah.
water's hitting my skin and I don't even feel the water hitting my skin,
Hmm.
right? Mindfulness when you're driving to work is looking at the license plate of the car in front of you
Hmm.
and being mindful about that license plate. Now, in Zynga, driving to work on autopilot, accidentally took the kids to work, didn't even stop at daycare,
Oh
right?
goodness.
Like,
Yeah.
that's mindless. That's autopilot. That's thinking about too many things at once.
Hmm.
And so when you can really, and people think meditation and they think mindfulness and like you got to do it for a whole hour, and that is very difficult. 15 seconds. I'll
Hmm.
give you a mindfulness trick right here,
Okay.
right? Everybody can do it with me right now.
Yes, let's do
About
it.
it as just bringing your focus and intention to one thing that's in this moment. So put your thumb against your finger, and I want you to rub your thumb against your finger, and I want you to feel the ridges of your fingerprints. That is mindfulness. We
Mm.
did it for 5 seconds, and if I had taken your pulse before and after, you would have seen a difference in how fast your heart is beating, right?
Hmm.
And so that's the sort of thing you get a craving for addiction,
Hmm.
feel your fingerprints. That'll bring down your craving. You feel like you're about to scream at somebody in this meeting at work, feel your fingerprints. That'll bring down your urge to scream.
I'm sitting in the staff meeting like this, everybody's gonna know.
Yeah, you just be like, oh, let me feel these fingerprints for about 15 seconds.
Yeah, let us know in the chat if you felt that difference because I'm curious because I definitely did. I felt like I calmed a little bit,
Hmm.
yeah, and I was able to really feel the ridges in my finger.
Hmm.
Yeah, I like that. I think we did have a couple of questions. I think, um, and I don't know if this was when you were describing Cage, but they asked, "What is Cage, and how do we support loved ones demonstrating addictive behaviors?"
Yeah,
It was
let's
actually from
go.
Dr. Graham.
Hey, Dr. Graham. Okay, so let's go back to Cage. Cage is a 4 question questionnaire that you can ask yourself or you can ask yourself about somebody else that gives you an idea if you're at risk for having an addiction.
Hmm.
And the 4 questions are C, so it's an acronym. C, have you ever thought to yourself, I should cut back? A, have you ever been annoyed when somebody else mentioned to you, like, man, you sure do spend a lot of time on that video game?
Hmm.
Or I notice you're smoking more marijuana. G, have you ever felt guilty because you said, I'm not going to do that today. And then you did that today.
Mm-hmm.
And E, eye opener. Is it on your mind first thing in the morning, or do you need to do that thing to like get started or make it through the day? If you
Mm-hmm.
answer one, yes, to any one of those four questions, there is 77% chance that you meet criteria for a substance use disorder, whether that's mild, moderate, severe.
Mm-hmm.
The other 23% are high risk. And so let's intervene before the substance use disorder develops. To answer the second part of the question, how do we support loved ones demonstrating addictive behaviors?
Mm-hmm.
Um, Listen, right? And so there's this concept called harm reduction. And harm reduction basically means I don't want you to die because you're leaving, because you're using.
Mm-hmm.
And some of the ways that we unintentionally contribute to people dying, whether that is they die today of an overdose or whether
Right.
that is they die slowly and languishing over time, is withholding compassion.
Mm-hmm.
So the symptoms of substance use disorders and addictions can be very painful for the people who care about you.
Mm-hmm.
We get angry, we get confused because we think that's you when
Right.
actually that's the illness,
Mm-hmm.
right? And so the first thing I want you to do, if you have a person you care about that is demonstrating symptoms of addiction, the first thing I want you to do is get support in place for yourself. Because you need to be able to go talk to somebody and say all that ugly stuff
Yeah.
and have them help you figure out a way to express your concern to your loved one with compassion. So the answer is compassion,
Yeah.
clear communication,
Mm-hmm.
and compassionate boundaries. So I tell this story. My favorite uncle, which is funny because I recently wrote a book. It's called Unaddiction: Six Mind Changing Conversations That Could Save a Life. It's available wherever you get books: print, audio, digital, Kindle, online, in stores. There's my promo for the
That's
book.
a great promo.
In the book, I tell the story of my favorite uncle, and then he was like, the biggest blowout is going to be that now everybody knows I'm your favorite. So I thought that was funny. He really struggled with severe cocaine addiction.
Mm-hmm.
He has continued to struggle for the entirety of my life. Um, and so there was a point when his illness was so severe and his symptoms were so significant that it was not safe for him to live in my grandmother's house.
Mm-hmm.
You can set this boundary two ways. You can say, get out of my house until you can make better decisions and stop being a bad person,
Mm-hmm.
which is thankfully not what my grandmother did. You can set this boundary and say, you're my son. I love you. I see that you're struggling. I want to help you, but
Mm-hmm.
it is not safe for me for you to live in my house. And so you cannot live here. That is the same boundary.
Mm-hmm.
First boundary pushes a person to the street into the shadows of stigma, unable to
Right.
ask for help, increases the risk of death. The second strategy, they still may go to the street, but they go to the street still connected,
Mm-hmm.
knowing that their mother loves them and doesn't want them to struggle. It is a very important difference.
Now, would you suggest, because watching on TV, because I've never participated in one, but you see people doing interventions, and it's always like a group of people, and the person with the addiction feels attacked because it's like they're all coming saying, "You need to get help. This is wrong. This, and on and on and on." Can you talk about doing an intervention and the way it should be done? It sounds like with compassion, but should it be the entire family coming to that person?
Yeah, I hate the classic intervention that you see on TV because
Mhm.
it's that first example, right?
Yeah.
It's like,
Yeah.
"Rah, rah, 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 rah."
Right.
And think about to yourself when anybody is coming at you like that, like, can you hear it?
Mm-mm.
You
Nope.
cannot hear that. You're just attacked, and then you go into a mode of needing to protect yourself. And
Mhm.
we're injuring you at a time you're already suffering, right?
Right.
And so I hate that concept of the classic intervention. Please, nobody do it and don't hire anybody to do it.
Yeah.
We do need to make interventions. We need to
Mhm.
make compassionate interventions. You want to try to start one to one, right?
Mhm.
That one to one. I see you. I feel you're struggling. I don't want you to be struggling. How can I help? You have to keep that person empowered to make their own decisions,
Hmm.
right? You can do it with a group, but like more than two or three people versus one is more than two or three people versus one. And it's hard when there are three of you, it's hard not to develop a gang up dynamic,
Right.
even if that's not your intention. And
Hmm.
so I prefer the one on one
Hmm.
with a professional if you need somebody to help mediate
Yeah.
that, like for sure,
Hmm.
definitely. But the whole family and this person, I know it's because you want to go through the whole list of things so that they
Right.
really get it. Like
Hmm.
the intentions are good, the strategy is not effective.
Yeah. So how does, I'm just curious, once the person does MAT and they've been, and they still may be going to therapy and they're doing all the things, what is the change that is seen in them? And how long
Oh,
does it take?
yeah, yeah. So usually you'll get your person back,
Yeah.
right? So like that's the thing. That's why substance use disorders can be so devastating too, is because like you knew this person before that.
Right.
And now you're like, I don't even know this person. You do know this person,
Hmm.
but your person is being what's the word? Like abused by this addiction,
Hmm.
right? And so
Yeah.
as the illness starts to get treated, you'll see they start to look more healthy physically.
Hmm.
Depression decreases, anxiety decreases, irritability decreases, reliability increases, laughter comes back,
Hmm.
things become fun again. They want to hang out with you, isolation decreases. You want to hang out with them, physical conditions get better, blood pressure goes down, diabetes gets more in control, you stop going to the hospital, you start getting that urge to work again, jobs come back, right?
Right.
And so to the answer to how quickly you can start to see that turn around, legitimately 1 week you can start to see that turn
Wow.
around.
Wow.
30
One week.
days, 30 days, that physical health starts to improve, those mood symptoms starts to come down, those mood swings start to improve. 30 days is a fantastic window
Hmm.
for seeing improvement, but this is what tricks people because you think you're done
Oh,
and
yeah.
you ain't done. Okay?
Hmm.
Just like if your blood sugar is 600 and I get your blood sugar down to normal range, less than 120, you are
Hmm.
going to feel cured. Like it's amazing.
Hmm.
Just because we did that in a few weeks does not mean you're done. You have to continue to work your formula for that diabetes.
Right.
And the same is true for addiction. And it just continues to get better and better and better. People will tell you like they continue to get more and more color in their lives. They continue to be able to add more and more color to the lives of the people they care about, contribute more to their communities. It keeps going the right direction, but
Hmm.
don't be fooled. This is a
Yeah.
chronic condition and you need to be working a formula. And that formula may change. Like
Hmm.
maybe 5 years from now, you don't need medication anymore because psychological and environmental is firing
Right.
on all cylinders.
Hmm.
But then something happens to psychological and environmental. Think of it just like diabetes.
Yeah.
Your blood sugar is great, diet, exercise, stress is low. People at work start acting up. Stress goes up.
Hmm.
Somebody dies. You lose your job. Suddenly your diabetes is out of control. Maybe I'm going to start medication back. So just understanding your condition,
Okay.
your formula, and
Hmm.
letting that formula be responsive, but knowing you have to work it for the rest of your life. It's a chronic condition.
Well, you actually answered my next question, which was how long you could stay on the medicine, but it just as
You can
long
stay
as
on
you
it
need it.
forever. Yeah,
Yeah.
you can stay on it forever. I want people to stay on no less than 1 year. So
Hmm.
the risk of relapse of a substance use disorder falls tremendously at 1 year of
Hmm.
remission. Remission means you don't meet diagnostic criteria. It doesn't necessarily mean complete abstinence for everybody, but if
Right.
you don't meet diagnostic criteria for that substance use disorder for 1 year, the risk of relapse falls substantially.
Hmm.
So I want you to take this medication for at least a year. Now, honestly, I want you to take this medication for 5 years because your risk of relapse does not fall back to that of the general public that never had addiction
Hmm.
until 5 years. So think of it just like breast cancer. You do your chemo. After you have your chemo, we're surveilling you, like you get your mammogram more often because your risk does not fall for
Right.
at least 5 years. The same is true for that substance use disorder.
Wow, this has been such a powerful and informative episode today. And I think you taught us a lot, especially about mindfulness and everything. But I have to ask one more question before you go, and that is, what feeds your soul?
Ooh, what feeds my soul? So I am an activist through and through.
Mm,
And all of my activists is centered on treating people right. And so
mm,
I think if we can have healthy self esteem
mhm,
and we can have healthy others' esteem, and there's a lot of biological, psychological, and environmental that goes into that. But if we can have healthy self esteem, that allows us to have healthy others' esteem.
yeah.
That allows us to live our lives with curiosity about people,
Mhm,
curiosity about things, compassion, and courage to speak up when we're not treating people right or when other people are not treating people right. That's
mhm,
what feeds my soul. And that comes out really in the work that I do,
mhm.
second, but first in the way I raise my kids.
I love that. I love that answer. But I lied. I have one more question.
Okay.
I said I wasn't going to do that, but I'm doing it. One more question. If someone wants to reach out for help, how can they find you?
Yes. EleanorHealth.com. We have tons of support and education and resources on the website. We're in 7 states. So if you're in one of our states and we take your insurance, we would love to be on your team. But
Mhm.
even if not, like come to eleanorhealth.com. And then if you just want to follow me kind of individually, you can find me on Instagram, Facebook, LinkedIn at Nzinga MD, like medical doctor.
Thank you so much. This was great. And
Thank you.
of course, I'm gonna have to have you come back we'll
Oh,
have to
thank
delve
you.
into some other topics. But let's see, for everybody else, for more information about addiction, head over to blackdoctor.org and catch up on all the articles over there. And as for me, I will see you guys. We'll be back on regular schedule next week, next Wednesday for a celebration. And we'll be taking a look at a question I see a lot on social media. What is the better option to remove body hair, sugaring or waxing? That's our own verses. That's what we're doing next week. So make sure you tune in and have a soul filled rest of the week, y'all. Bye.